Physicians bridge communities, and now physicians bridge healthcare economics. Too often, we hear and see all of the new regulations and system processes that negatively impact our physician colleagues and ultimately patient care. We are physicians, not healthcare practitioners. We are physicians, not providers. And we are physicians, not healthcare system employees. And as physicians, it is our responsibility to redirect the course of healthcare. And with your vote next month, that is what I am prepared to do as a member of the American Medical Association Board of Trustees. As the former chair of the AMA Resident and Fellow Section, I had the honor of working with and representing many of the resident and fellows from across the country on a number of issues, including student debt and ACGME funding reform. But I also had the opportunity to make some new friends with physicians who have been working in the field for more than 20 or 30 years in private practice. And unfortunately, many of them were forced to leave the patients that they loved so dearly due to the corporatization of medicine. The story of Dr. Johnson is unfortunately not an unfamiliar one for many of you. Dr. Johnson built his own medical practice from the ground level up 30 years ago in a suburb of Pennsylvania. He was fond of the relationships that he built with his patients and their family members. He had his own schedule, worked with his patients at his own pace, and personally knew all of the patients and their families, and was truly engaged in the life decisions of many of his patients and their family members. But slowly, Dr. Johnson began to feel the pressures of a growing healthcare system, in which the bureaucratic system crippled his practice with increasing roadblocks, such as work lists and checklists, increased regulations, EMR systems that were just too cumbersome and expensive to manage, and regulatory hurdles that were just too much to bear. And unfortunately, Dr. Johnson had to retire and close his practice due to the growing corporatization of medicine. As a future member of the American Medical Association Board of Trustees, I will work to protect and preserve the physician-patient relationship from boardroom decisions made across America that are going to be making it harder for physicians to practice and to take care of their patients. We are seeing astronomical rises in the cost of healthcare. With the rising cost of technology, such as mandatory EMR, the increased regulation and paperwork by the federal government, as well as decreased reimbursement and increased malpractice premiums by insurance companies. Out of the national expenditures for healthcare costs, only 9% is collected by physicians. Where is the rest of the money going? This is the bridge that we must build with the community to educate the public that physicians are here to serve and to heal, and that the real threats to the economic makeup of the healthcare system lies elsewhere. Our patients depend on this, and the future of our profession will be impacted by the decisions that we make today. The time is now, as an organization that represents all of medicine, to educate the United States Senate to produce a healthcare law that ensures that everyone has secure access to healthcare for all patients, a reduced administrative burdens that drive up the costs of healthcare, and leverage existing technology to improve healthcare delivery and to protect patients with chronic diseases, as well as promote the funding and research through the NIH. There are a number of ways for us to achieve these measures. We can allow for Section 1332 waivers to enhance state innovation to provide affordable access to care, improve patients' ability to choose their own physicians, open Medicare buy-in options for people aged 55 to 64 years old, increase insurance marketplace competition, and access to vaccines and primary care for men, women, and children, reauthorize CHIP, allow for price transparency both in drug pricing as well as healthcare, and work on substantive tort reform for all physicians. Together, we will restore the physician-patient relationship. physicians bridge communities, and together, physicians bridge healthcare economics. I humbly request your vote next month for the American Medical Association Board of Trustees.